everyone, my name is Donna. Thank you for clicking on this video. Today I am going to share with you guys why I disappear. I came home from prison in 2011 and I already knew that I had a kidney stone or something wrong with my bladder. I constantly had reoccurring kidney infections and bladder infections. A lot of those kidney infections, were negative for bacteria. So I was pretty sure that I had a kidney stone. I got home and within just a couple of months, I found that I was pregnant with my daughter Bella. And so I had to put the kidney stone stuff on the back burner because now I was pregnant at an older age. It was a high-risk pregnancy. The kidney stone, it just had to sit where it was. I knew that I had one and it was in my right kidney and it was 5 centimeters. Well, at the end of my pregnancy, I got really, really sick, and I'm very, very stubborn. I'm a bull, and I wouldn't go to the doctor. I'm like, nothing's wrong. It's just a bug. It'll pass. Well, it didn't pass. I got very, very sick. My sister came, and she made me go to the hospital. When I got there, I had 103 temperature, and I found out that me and Bella were septic. The kidney stone had blocked my ureter and was backing up urine, and it had gotten into my bloodstream. I got very, very sick. I had to stay in the hospital for about 3 weeks, and during that stay, they gave me way too much fluid, and I swole up the size of a cow. I'm not kidding you. It was abnormally swole. It was a horrible, horrible experience, but it was the first of many bad things that happened to me physically that got me to this point to where I am at now. I ended up having Bella, and let me stop. So I have Bella, and I am immediately referred to my first urologist. I am reluctant to say his name, but I want to say his name because he did this to me. I feel like he did it to me, and I will never not believe that. It couldn't be proven because I tried to prove it. I hired an attorney and everything. So I seen my first urologist, Dr. Plunkett. Obviously, you can see that I'm very, very bothered by that situation because it took my life. So I see this urologist, and he tells me what I already know, that I have a 5 centimeter kidney stone stuck, and they were going to do immediate lithotripsy. If you don't know what that is, it's electric shock therapy. It's where they stick you in water and they shock the kidney stone and bust it up. It's a crazy thing, and I don't think that it should be done on women, especially in their lower regions. So I'm trying to hold it together because this whole situation upsets me a lot because he took my freaking life. Okay, so he does these lithotripsies on me. The first one that he done, it busted it up a little bit, but he had to put a stent in there, and the stent dislodged. And I called them, and I'm like, I am in horrible pain. I've had a stent before. I know what a stent feels like. I've had one before. I told you guys, if you've read my blog, I've had a stent before. I knew what it was supposed to feel like, and I knew that something was wrong. So I call up there, and I'm like, number one, the medicine that you give me is not working, and there is something wrong. So they're like, the nurse at the place says, this is how it is with stents. You need to pull up your big girl panties. I will never, ever forget her saying that to me because I am tough. I am so freaking tough, and I can handle a lot. But I knew something was wrong. So back into surgery, no less than 2 weeks later. So he goes in and he takes out the kidney stone. He takes out the stent, and he does another lithotripsy. and it busted up a little bit more. I pass a little bit more. It goes down a little bit, and then 2 weeks later, he does another one. This is the third lithotripsy every 2 weeks. So the third one, I woke up and they told me I had started my period. I knew that I hadn't started my period because I just had my period. I said, no, I didn't start my period. Something is wrong. No, you started your period. And I'm like, okay. So I just went with it. I went home. I was still in horrible, horrible pain. I knew that something was wrong. It was horrible. So I healed a little bit and I went back in for the fourth time. And it was 2 weeks, 2 weeks, 2 weeks, 2 weeks. So I hadn't even, my body wasn't even healing. It was just getting shocked and shocked and shocked, trying to bust up this kidney stone. And the fourth time, I woke up in another pool of blood, bleeding vaginally. Oh, you started your period. No, I didn't start my period. That doctor, he shocked me way too many times in my bladder and in my female organs. So he hurt me. Okay, back to this. Of course you can see that I am super emotional about this. So it's hard. Okay, where am I? I don't want to just cut it off and start and keep doing it like that because I want you guys to feel it. So the fourth time I woke up and I was bleeding and I knew something was wrong and I wasn't going back to him. I said, okay, I know what I'm going to do. I'm just going to go to my general practitioner. I'm going to get her to prescribe me some pain medicine and I'm going to pass the rest of this kidney stone myself. And at that point, I had post-traumatic stress disorder from urologists because I knew that he was hurting me. I just didn't know how bad he was hurting me. So I didn't see another urologist because I was scared to death of them for about 2 years. But I kept having pelvic pain, constant UTIs with no bacteria. And so I knew that I had to do something. I had to find another urologist. So I went to see another urologist. This time I found one that is a lot better, but she has no idea about the bladder disease that I have. So I go to this new urologist and she immediately, I tell her my story and I'm snot crying and she's just shook. She said, first of all, it's illegal to do lithotripsies on a female that far in her female organs. So I knew that, and she said something wasn't right. So I was sent to a gynecologist for the pelvic pain. I had 2 referrals, for the urologist and for the gynecologist. I go to the gynecologist, and he says, we need to do exploratory surgery. This is crazy, get this. Okay, so right after I have Bella, I get my tubes tied. They put in these things called Hulka clips to clip my fallopian tubes. And apparently, all the shocking that was being done to my area busted up the Hulka clips. They're gone. The Hulka clips are gone. I passed them. I don't know what happened to them, but they're gone. And my fallopian tubes were like, they said that it was shredded. It was like the end of a shoestring, kind of like it was just shredded string. And that's what my fallopian tubes look like. So you could tell that something had freaking destroyed them. And it was them being shocked. The Hulka clips are plastic. So I don't know. I don't know about that part. And I still have, it's like this great mystery. Where did the Hulka clips go? But apparently they were busted up along with the, no, they weren't plastic. They were metal. I'm sorry. Forgive me. I'm trying, you guys. This is tough. They were metal, and apparently they were busted up. Apparently, the whole time they're trying to shock that kidney stone, they were shocking them clips. And my pelvic pain has always been a 10 since I came home from prison, since I had Bella. It has been non-stop. So the gynecologist goes in there. He sees that there's no Hulka clips and that my fallopian tubes are destroyed. He recommends that I get a hysterectomy, and that maybe that will fix my pelvic pain. Still yet, I'm not diagnosed with the bladder disease yet. So giant leap of faith, I let them do a hysterectomy on me. And I didn't even have to. God, it pisses me off. So they do the hysterectomy, and I still have pelvic pain. And I'm hurting. I'm like, man, what's going on? So by then, I see the urologist, the new one, and she is like, you have a bladder disease called Interstitial Cystitis. It is formerly known as painful bladder syndrome. It's also called IC. So I'm like, whoa, okay. And she's like, I'm going to need to do a surgery. And I'm like, ugh, another surgery. Oh my God. I've had 4, 5, 6 up to this point within just a couple of years' time. I'm like terrified. Oh God. But if she could help me, I'm like, okay, I'm going to let her do it. So she does it. She did a cystoscopy and a hydrodistension, I think is the name of it. They go inside your uter. They fill up your bladder with water and see how much it can hold, and see if there's anything in your bladder that, like lesions or ulcers or something like that, sores. So she goes in, she blows it up, and she sees lesions. And my bladder's covered in rips and tears. So I immediately knew that was from the shocking. I knew it. I still know it to this day. Nothing can tell me any different. I know that it came from that doctor shocking me. He was like freaking 80 years old. I don't even know why I let him. I was desperate for relief. But so I'm seeing this new urologist, and I still see her today, but there's nothing that they can do. I mean, like, the other 2 things that they can do before bladder removal is Interstim device. It's a device they put in your back. I already have chronic back problems. I have degenerative disc and joint disease, so they're degenerating at a very fast rate. So my chiropractor said he didn't think that the Interstitial device would be a good idea for me. And then the other thing is Botox in your bladder. But the thing with Botox is you have to get a catheter afterward, and you have a cath bag for a few days. You can not pee like up to a month or something. And I can handle the retention. I can handle urinating every 10 minutes. 15 minutes. I can't handle the pelvic pain. That is the part that just shuts me down. Like, I'm going to show you guys something. Like, I know this is crazy, but if you look right here, those are burns from the heating pad. I have them all over my legs. It's horrible. There's no cure for this disease. It's like, we know more about it than urologists do. And so they've been wanting to do more installations. And installation is when they stick a catheter in you, and it's painful for me because of all the trauma and scar tissue in my urethra. It's painful to be cathetered, period. So they use a pediatric catheter. An installation is they go in and they release all of the urine in your bladder, and then they fill it up with like lidocaine or something. It helps for like 10 minutes. It numbs it up. But then the pain of them jabbing the catheter in is just not worth it to me. So I quit letting them do the installations on me. They just weren't helping. And I started researching about this disease. So I start researching about this bladder disease and what I could do on my own to heal it, because I believe if I could get the lesions to heal, I could get some relief and have somewhat of a normal life. It strips away my sex life with my husband. It strips away everything. Like, I can't be a normal human being. I've been looking at this paddleboard. Chris got me a paddleboard. That's my husband. See, he got me this paddleboard because he knows I've been wanting to do it so bad, and I just said, look at it. Okay, I'm trying to pull it together, you guys. I got tears on my nose. So with this bladder disease, it causes you to go into flares. You have to eat a very, very strict diet. This is what I eat every single day. And I do cheat, and then I suffer for it. So I eat oatmeal in the morning, and like during the day I'll have little snack pretzels or something, and then at night I eat rice and beans with a veggie. Sometimes I don't even eat a veggie, I just eat the rice and beans. And that's my diet. That's what I live on, which it's not so bad because, I mean, I weigh more than I have in a very, very long time, but it also, like, it strips me of these flares. Like, I've been in a flare for 3 weeks, and I'm still in it, but I have pretty much got it under control with pain medicine and my supplements. That's why I disappear. It's not because I want to. It's because my bladder is on fire. It's like I'm pissing razor blades in labor at the same time, having contractions. Like, there's no other way that I can describe what this bladder disease is like other than pissing razor blades, labor, contractions, all at the same time. And we'll say even throw a kidney stone in there. Like, freaking, it's like the worst pain you'll ever, ever imagine. There's so many other things I would have rather have been dealt, because this just totally just takes my entire life. Everybody suffers from it. I suffer from it. My whole family suffers from it. It's not just me. And that's the part, because I'm strong. I can handle this. I mean, I can, but there's just no research done, and there's no cure. And so I've just spent the last couple of years trying to heal myself. I use aloe and about $300 a month in supplements. I'm trying to heal myself, but it hasn't worked so far, and I just keep hurting myself worse. So I am seeing a new doctor in a couple of weeks, and supposedly they are a IC specialist. I ain't even gonna lie, I have canceled the appointment like 4 times. They said, if you don't come this time, we're not going to see you. I'm like, man, you don't even know. They already, as soon as I made the appointment, they're like, okay, well, we're going to schedule you for another hydrodistension and cystoscopy. We're going to schedule you for a follow-up. Then we're going to schedule you for a urodynamics test. And I'm like, whoa, no, you're not going. No. We got to figure out another way, because you're not going back inside of me. Like, no. So when I disappear, that's why I disappear. I'm getting well and I'm trying to heal. I'm sorry for crying. I just wanted to let you guys know, like, with this bladder disease is so wretched, and there's so many of us that suffer from it, and there's no cure, there's no research, there's just nothing. And our doctors know nothing. It's horrible. Like, when I hired the lawyer, they said they couldn't prove that he didn't do it, or that he did it, and that, like, the kidney stones didn't, or that it's just not, like, or that it's not hereditary, I just didn't catch it or get it or whatever. They couldn't prove that he done it, is why I couldn't sue him, but I wanted to, because he took my life. So it's been like this now for a few years, and I'm just trying to just be the best mom I can be the best wife I can be. It's hard, though. especially knowing somebody did this to me. I know he did it. Those times that I woke up in blood, like, that's not normal. That is not normal. Even the urologist told me that it's not normal. So, when I disappear, that's why I disappear. This bladder disease. All right, I've poured my heart out. And now I'm going to have to suffer for it all day. But I just want you guys to be aware and to know. And then with this opioid freaking crisis going on, it's like people like me are suffering behind it. My general practitioner quit her job because she couldn't treat her patients the way that she seemed fit. She quit. And so she sent me and my mom, who have been going there forever, to pain management clinics. And the pain management clinic is horrible. I can handle them because I got thick skin, but man, my mom leaves there snot crying. They are so mean. It's like I want to go with her because I will cuss them out being mean to my mama, but it's crazy. And chronic pain patients are suffering behind this opioid epidemic. People don't freaking die from taking a Lortab. They're dying from fentanyl and heroin and from buying street drugs and stuff. That's a whole other subject. And I'll give that to you guys. But IC has robbed me of my life. I went from one person to another. See you guys next time.